Can the McKenzie method cure your slipped disc? So this is what we're going to be talking about today: prolapse disc, slipped discs causing back pain and sciatica, and what you can do at home straight away to help solve this issue. So my name is Dr. Jeremy Andrews. I'm a doctor of chiropractic here at West Chiropractic in Surrey, and we help people with chronic low back and knee pain avoid a lifetime of painkillers and surgery. So what is the McKenzie method? You may have heard of this. It's also known as mechanical diagnosis therapy, so MDT. A system of assessment and exercises designed for people like you with back issues, neck issues, specifically coming from disc problems. There's certain movements, they say, can reduce pain, improve function, and even help the spine heal over time. So it focuses on finding movements that are going to centralize your pain. So what that means is it's going to shift the pain from areas in your legs, like sciatica, all the way into your back. And that is a sign that the disc is reducing its pressure on the nerves. So it's really effective for disc problems, because a disc bulge, it slips, it can irritate the nearby nerves, causing pain, tingling, or weakness in your arms or your legs. And the McKenzie method helps relieve this pressure by guiding that disc back into a better position through certain movements. So there are three types, or three areas they work on. The first one is derangement syndrome. This is the most common syndrome. The symptoms of the derangement syndrome may be it's local, referred, radicular. The symptoms could move from side to side, so from one leg to the other, and they can be at the top of the leg or the bottom of the leg. They can be very constant, or they can be intermittent. So it's completely random and can vary throughout the day. It can also be very sudden, or it can just happen gradually over time. So treatments are going to involve specific movements that cause the pain to centralize and get that back into the central part. The second syndrome is dysfunction syndrome. So this is where the pain is a result of a mechanical deformation or structurally impaired tissues, so like scar tissues, or short and contracted muscles like muscle spasm. So symptoms on this, they're from 8 to 12 weeks, and the time is allowed for the tissues to deform. The pain is always intermittent and arises right at that end range of movement. The treatment is going to include repeated movements in the direction of the dysfunction, or in the direction that reproduces the pain. Okay, so opposite the derangement, you want to reproduce the pain. The aim is to remodel that tissue, which limits the movement through exercises, and they're going to become pain-free over time. And then the third one is postural syndrome. This is the last one. This is going to refer to pain which occurs due to mechanical deformation, again, of a normal soft tissue from prolonged range loading of the periarticular structures. So what that means is essentially the pain arises from a static position of the spine, like sustained slouching or sitting like this. There's a lot of pressure on the shoulders, and the pain will then disappear when the patient moves out of that static position. So you sit nice and upright, there's no pain when performing that range of activity. So treatment includes patient education, correction of that posture, improving the posture over long term, and trying to improve the lumbar curves, the neck curves, and avoid prolonged kind of tensile stress, like sitting or using your iPhones and iPads. So we take those out completely. So the McKenzie method, it works on 4 key steps. So the first one, assessment; second one, classification; third one, treatment; and fourth one, prevention. So let's go through them step by step. So the assessment, we start by understanding your unique pain pattern. For example, does your pain get worse when you bend forward or when you sit down for long periods? That's very typical of derangement syndrome coming from a disc. Or does it improve when you walk or you lie down? This helps to identify which movements or positions are going to centralize that pain and reduce the disc's pressure on your nerves. Second one, classification. So based on the assessment, the response during those repeated sustained movements and testing, we're then going to give you a classification. So most patients' symptoms, they're going to be classified into derangement syndrome, dysfunction syndrome, or postural syndrome. We've gone through these already. And the choice of exercises in McKenzie method is going to be based upon the direction that causes the symptoms to decrease, centralize, or completely get rid of them. Third one, treatment with targeted exercises. So once we know what works for your pain, we'll guide you through those specific exercises that promote healing and reduce the discomfort. So the goal here really is to empower you to manage that pain at home without having to use someone like myself, like a chiropractor. So you haven't got to rely on us in the long run. And then finally, prevention. We want to teach you how to prevent further issues by maintaining good posture, incorporating regular movements, avoiding the positions that might aggravate your disc, like prolonged loading in flexion. So how does it work? Let me show you in terms of what are the exercises that we do for the McKenzie method. So it's super important to remember that I am not a McKenzie method practitioner. I'm just giving you some advice based on what I know, and it's really important to go get proper advice from a McKenzie practitioner themselves. So I'm going to give you my take on it and the way that I manage it myself, but I'm not a professional with the McKenzie method. So it's really important you do these exercises under the guidance of a professional, someone who is trained in McKenzie method, and ensure that you're safe and it's effective. So we're going to start with prone lying. This is the number one. So first things first, very gently prone lying like this. So they suggest that this is really simple, you're simply lying like this, lying your head to one side to reduce the pressure on your back. They say with the derangement syndrome, this is going to be one of the most comfortable positions to lie in to take pressure off your disc. So lie like this for 1 to 2 minutes. This is going to be the first step to the McKenzie method. I know what you're thinking, easy, right? So bear with me. The next point, number 2, is prone elbows. So you come onto your elbows like this, keeping your hips in the same position, and you try and arch your back like this. Not too far, we're not doing a full cobra like this, we're pushing all the way up. We're literally just causing some extension through the back, helping to reduce that nerve irritation by providing some extension to the lower back. Aim is to hold this for 30 seconds. Keep your neck straight like this. Don't turn it like that like I am. I'm just looking at the camera. But turn like this. Make sure you're nice, so keep your head nice and straight like this, and then relax back down. Head down, rest for 30 seconds, and you come back up for 30 seconds. So this is a really simple exercise for someone to do when they're in excruciating pain and the only position they can lie on is actually on their tummy. It can be a really beneficial way to just get some pressure off your back. Repeat this 5 to 6 times. Okay, that's step 2. And phase 3 is going to be bigger than that. This is like a cobra, okay? So we're putting our hands underneath our shoulders and we're pushing all the way back up like this. Now, if you're in acute disc pain, you're going to struggle to do this in the first 24 to 48 hours. You may even only be able to do step 1. So pushing up like this, holding for 30 seconds, and then coming back down, rest for 30 seconds, and turn your head to the side as well. Keep the hand under the shoulders, centralize the head, and then we push back up like that. Hold for 30 seconds, keep the hips in the same position, and then rest back down, roll the head to the side. Repeat 5 to 6 times. And then this one is extension in standing. So this can either be stage 4 or it could be stage 0. If you're really struggling to lie on your front, then you have to do this standing. So putting your hands in your back and then slowly trying to extend back like this, keeping the hips in the same position, and then come back to the center. Let me show you from the side. So putting the hands like this, pushing like that, and then come back to the center, and then very slowly pushing back again, and then coming back to the center. So repeating 10 times can be very good if you're struggling to get that extension in lying. So the prescription of these exercises does depend on how much pain the patient is in and also what's happened in the classification phase. So let me go through usually what a typical prescription will look like. So it's usually 5 to 6 repetitions of the movement every 2 hours. So take motion to that end range, and it's always really good to have that postural awareness, and then you want to make sure that you're following up over 24 to 48 hours to assess the progression. The clinician will then assess that baseline level of where the symptoms were to where they are after prescribing the exercises. And then if the patient is coming back with significant reduction in symptoms, then often no change is given to the prescribed activities. It's just about trying to maintain, be consistent, and keep repeating those as you go forwards. The benefits of the McKenzie method. So one of the best things is how empowering it is. So it's so effective for people with disc issues. So first thing is pain relief. The exercises are really designed to reduce the pressure on the nerves and the disc, which is going to help any sort of residual symptoms in the legs and arms like pain and tingling. Also helps to improve your mobility by restoring the alignment and the function of the vertebra and the disc, which helps with movement and less stiffness. Also, it gives you like self-management tips. So you learn how to manage your own symptoms, gives you more independence without the need for constant treatment. And then fourth thing is prevention. By maintaining that good posture, incorporating the regular exercises, you can reduce the risk of that problem coming back in the future. So how do we help you at West Chiropractic? Well, we can show you how to do these things. As I say, I'm not a McKenzie professional. I can give you some very basic advice, but if you do want to take it further, I can then recommend people for you. But there's other ways we can also help as well with spinal decompression, with core stability, shockwave therapy. We can help you feel better, move better, prevent further issues. So if you'd like to learn more about that, please give us a shout on info@westchiropractic.co.uk. You can book a free discovery visit in the comments below. And as always, you can grab copies of my best-selling books here, The Secret Cure to Back Pain, How to Avoid a Lifetime of Painkillers and Surgery, and How to Transform Your Back. Thank you so much. We'll see you next time.